Welcome. Today we will discuss about atrial fibrillation. Atrial fibrillation is an irregular and often rapid heart rate that commonly causes poor blood flow to the body. During atrial fibrillation, the heart's two upper chambers, the atria, beat chaotically and irregularly, out of coordination with the two lower chambers, the ventricles, of the heart. Atrial fibrillation symptoms often include heart palpitations, shortness of breath and weakness. Symptoms. A heart in atrial fibrillation doesn't beat efficiently. It may not be able to pump enough blood out to your body with each heartbeat. Some people with atrial fibrillation have no symptoms and are unaware of their condition until it's discovered during a physical examination. Those who do have atrial fibrillation symptoms may experience signs and symptoms such as palpitations, which are sensations of a racing, uncomfortable, irregular heartbeat or a flip-flopping in your chest. Weakness, reduced ability to exercise, fatigue, lightheadedness, dizziness. Atrial fibrillation may be occasional. In this case it's called paroxysmal atrial fibrillation. You may have symptoms that come and go, lasting for a few minutes to hours and then stopping on their own. Persistent. With this type of atrial fibrillation, your heart rhythm doesn't go back to normal on its own. If you have persistent atrial fibrillation, you'll need treatment such as an electrical shock or medications in order to restore your heart rhythm. Permanent. In this type of atrial fibrillation, the normal heart rhythm can't be restored. You'll have atrial fibrillation permanently, and you'll often require medications to control your heart rate. Most people with permanent atrial fibrillation will require blood thinners to prevent blood clots. When to see a doctor. If you have any symptoms of atrial fibrillation, make an appointment with your doctor. Your doctor may order an electrocardiogram to determine if your symptoms are related to atrial fibrillation or another heart rhythm disorder, arrhythmia. Possible causes of atrial fibrillation. Abnormalities or damage to the heart structure are the most common cause of atrial fibrillation. Possible causes of atrial fibrillation include 1. High blood pressure. 2. Heart attacks. 3. Coronary artery disease. 4. Abnormal heart valves. 5. Heart defects you're born with congenital. 6. An overactive thyroid gland or other metabolic imbalance. 7. Exposure to stimulants, such as medications, caffeine or tobacco, or to alcohol. (8) Sick sinus syndrome, improper functioning of the heart's natural pacemaker. 9. Lung diseases. 10. Previous heart surgery. 11. Viral infections. 12. Stress due to pneumonia, surgery or other illnesses. 13. Sleep apnea. However, some people who have atrial fibrillation don't have any heart defects or damage, a condition called lone atrial fibrillation. In lone atrial fibrillation, the cause is often unclear, and serious complications are rare. Tests and diagnosis. To diagnose atrial fibrillation, your doctor may review your signs and symptoms, review your medical history, and conduct a physical examination. Your doctor may order several tests to diagnose your condition, including electrocardiogram, ECG. An ECG uses small sensors, electrodes attached to your chest and arms to record electrical signals as they travel through your heart. This test is a primary tool for diagnosing atrial fibrillation. Holter monitor. This portable ECG device is carried in your pocket or worn on a belt or shoulder strap. It records your heart's activity for 24 hours or longer, which provides your doctor with a prolonged look at your heart rhythms. Event recorder. This portable ECG device is intended to monitor your heart activity over a few weeks to a few months. You activate it only when you experience symptoms of a fast heart rate. Blood tests. These help your doctor rule out thyroid problems or other substances in your blood that may lead to atrial fibrillation. Chest X-ray. X-ray images help your doctor see the condition of your lungs and heart. Your doctor can also use an X-ray to diagnose conditions other than atrial fibrillation that may explain your signs and symptoms. Thank you. Like, subscribe and share. Thanks for watching.